You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Ruchi Kapila, Punjabi-American, non-binary speech-language pathologist, vocologist, and voice teacher who specializes in gender-affirming care in voice for trans and autistic individuals. Through their work at Kapila Voice and Speech Services, Ruchi is paving the way for more inclusive and supportive voice therapy. Today, we'll be discussing the challenges, successes, and profound impact of gender-affirming care on the lives of trans and autistic folks. Welcome to the podcast, Ruchi Kapila.
Hi, Jeffrey. Thanks for having me. I'm so happy to be here today.
Well, you're going to be bringing a lot of different perspectives and a lot of different points of view as we kind of start to talk about how to empower people, give them the voice, give them the ability to be who they are, and for us just to be supportive through that process. But before we go there, I always want to get the backstory. And one of the things I'd love to know is what sparked your initial interest in autistics and the field of voice therapy with autistics?
Well, it was all very, I guess fate decided. I knew when I was in graduate studies, like there were times where I was doing academic coaching with other autistic adult individuals. And the interesting thing about that was I felt more at home working with adult autistics than I did even like talking to people who were in my speech language pathology cohort, which should have been a big sign. And then when I was clinically practicing, I was working more in acute rehab and acute care for people who are post-stroke, post-brain, like traumatic brain injury, in terms of recovery for cognitive communication skills, like executive functioning, as well as motor speech, language disorders such as aphasia, as well as like swallowing disorders. So I didn't necessarily get to work with neurodivergence in like the way that we usually think about it, which might be more related to people who are autistic or people who are ADHDers. But we definitely working with like people who are neurodivergent as a result of like an acquired neurological change. And so I didn't find myself like pulled into it until I ran into a friend at a party who was also autistic, and they had told me to really like think about it in terms of some of my communication patterns and things, and to see and investigate whether that was something that applied to me. And I realized that like my whole life, there was this sense of feeling alien. And I think part of it was that non-binary gender piece, but then part of it probably was the autistic ADHD piece. And so there was a lot of, therapy, navigating like what it was like to be in this community, understanding why I was a magnet for other neurodivergent people as friends. And as I thought about voice work, as I developed as a singer, I think learning to sing and learning technique and stuff in more traditional teaching methods was really difficult for me. And I had to work with a ton of different people. I needed time. I needed to become a speech language pathologist too, to understand my voice really well. And ever since then, I think what I wanted to do was for like people who are neurodivergent, I wanted to make voice feel more accessible and attempt, to change teaching modalities and understanding and integrating our sensory experiences.
And I love that. Oftentimes it's the self-exploration. It's the kind of the ability to kind of share one's experience in that passion that turns everybody's viewpoints, helps us to become a little bit more open-minded and to take on different challenges. And one of the things I think that clinically has been a flaw over the years is that even in the terminology we're using is that I initially started with autistics, but neurodiversity goes way beyond that. And
yeah, for sure.
Techniques go way beyond just having one bucket to say every single person who's neurodiverse needs to be taught, needs to learn, needs to be able to develop vocal skills in different ways. So why aren't we teaching them based off of who they are, where they're at in their journey, and helping to empower those skills. So I guess that the big thing that always comes to my mind is, how are you taking some of the concepts of what you said, of so many different identities, so many people coming from different experiences, different skill sets, and integrating that into vocal coaching, into the work that you're doing right now?
Yeah, I mean, with gender affirming voice, a lot of it is about choice. I think it's a lot of it is about, the interview process is so important in terms of helping for somebody feel safe and comfortable to share what their inspiration points are with you, their how they want to use their voice. I mean, for a lot of clients that I work with, it's like, I want to be able to, stream when I'm gaming, or and I want to feel comfortable with my voice, or maybe I'm gaming online with my friends and I want to feel comfortable using my voice instead of keeping my mic off, or it may be like, a myriad of different things, of just, interest levels. A lot of people come in with interests around, like, I'm really good at doing voices for Dungeons and Dragons or D&D, but like being able to apply that skill set into a voice that feels true to me is really difficult. And so it's all about kind of setting up where are the places that a person feels really comfortable, and like competent in making voice changes, if any of those places exist, and how do we bridge from that, from a place that feels like really client centered, and so and achievable. I mean, there are times where I've worked with people, and they're like a very standard, let's say, a home program to engage with every day, or a set of warm-ups to engage with every day. They're like, that I'm not going to be able to do that, or that's not going to be something that realistically I'm going to be able to use. And so adapting that to, hey, it doesn't have to look like this. It can be when you have points of inspiration. Some clients I'll watch a whole bunch of, like, voice acting samples with, and we'll go through and then kind of decide, oh, that one's something really nice that like strikes something for me. Let's see how it feels to adapt to that, and talk about some of the features that we're hearing in the voice as it pertains to like pitch or resonance or other kinds of qualities that are coming up. So it's all about kind of meeting people where they're at, what they're used to working on, finding what their passion point is. And taking into account that every neurotype is going to have times where, like, we can take advantage of things like hyperfocus, or basically space things out in the sessions so that we have time for conversation, where we're not necessarily super targeted on, like, what the voice target is right now. Or and I think we have to, as clinicians, really reframe our ideas about productivity, as well as like what engagement from our clients looks like, because oftentimes we're trained to expect a very neurotypical presentation of adhering to a plan of care or a treatment course to see success, and it just isn't true for a lot of the individuals I work with.
Yeah, and I want to get into how you set up your sessions and how you work through that. But before we go there, I think there's some macro things that we should explore. And
Sure.
one of the components that you just stated, I think, is really important, is that being able to identify one's own goals, one's own preferences, and to be able to set up their plan around that, being client centered. That wasn't always the case, is that there is a lot more of a pejorative view of, this is how you're supposed to do it. If you're not doing it this way, you're wrong. Where now I think that with a little bit more of the neurodiversity affirming viewpoint that is finally pushing through, it's saying, no, well, we want you to tell me what you feel like is right, and let's help you get to that goal. Let's help you achieve that, versus telling somebody that you're wrong because you don't fit in. Is that kind of the gestalt that you're seeing right now, where there's finally movement in the direction of the way that you're setting up your framework?
Sure. And oftentimes the challenge with it also is that we have a bunch of clients who've maybe gone through more strident or strict sorts of modalities before. And so the idea of being client centered for them, or having that kind of agency, is something that they need support around as well, because they're like, well, what do you think? Or whatever you think is right. And so sometimes has to be this like gentle pushback as well as compassion around having that kind of, approach to therapy or approach to these services as a client. And so oftentimes, if I'm in that position, I'll make the goals very broad and say, we're going to have, that it's going to be a self-chosen, client area for like whether you're happy with pitch or resonance or intonation or what kinds of activities you want to be able to use this voice in independently. But I'm going to keep it really broad because maybe as we move along you're going to change your mind about where you want the focus to be. Mm-hmm. and make them more adaptable to what feels functional for you as a client. So I think there are some challenges in terms of making things client-centered because of those models that we're deconstructing now, but I'm feeling confident about it in terms of us, being able to maintain that flexibility when we're creating a course or plan of care.
Yeah, I mean, and correct me if I'm wrong, but I think I just heard you say that you have people coming into your sessions initially that maybe even are scared to have their own opinion or not empowered to voice that and that's you almost have to establish that self-esteem or that ability to feel like, I have value before you can start working on any of that. Is that kind of the trauma that you're working through initially with some people I need to give you back that agency?
I'm always excited when I have somebody who has a lot of opinions because I feel like that takes a lot of the work out of it for me in a way, but I definitely feel like a trauma-informed care model is really necessary for a lot of clients we work with, and oftentimes I have to demonstrate for them through different activities that we do to show, hey, you do have a preference, between these two things. Like even though initially you said that you're not sure, as we like listen to different types of voices or talk about things, or you talk about where things feel comfortable or not, then I get to kind of mirror back to them, hey, these are natural opinions or perspectives that are coming from you without my prompting. And we can have a conversation about whether we want to work that into the goal. And so being able to kind of take those small steps towards clients getting to feel more agentic and feel like they have more choice in the care that they're providing, and building that foundation for self-advocacy it's definitely a journey, but I'm grateful to be a part of it.
Yeah, and when we spoke initially, is that you let me know that you identify as non-binary, which I mean, I think is probably a pretty important perspective for you to be able to understand some of the components of gender-affirming care, some of the barriers that others might have gone through while being empowered through gender-affirming care. But I don't know that everybody understands what gender-affirming care really is, but B, how much of an impact it is when we're doing that correctly, when we're not bucketing somebody initially just because that's where we feel like they need to be. Instead, we're empowering them to be who they want to be and who they are, who they identify as. But can you give us a little bit of background on what gender affirming care is and how that impacts your clients' lives?
Gender affirming care is everything for me, and I think in practicing it, I apply it to all people, whether we presume somebody is trans or gender expansive or not. I think a lot of it is to take into consideration a tenet that the person themselves knows who they are and they get to define gender per their lens. And what about that, whether it is femininity, whether it is masculinity, whether it's gender fluidity or non-binary identity, they get to identify with the parts that they want or don't want and how they want to express themselves externally, and how they want to experience gender internally is an individual experience, and that's not something for me to judge or to code. My role as the provider, especially when we're thinking about voice and communication, is to see, kind of throw the darts and see where does this client feel most aligned, most comfortable, most confident with their voice and communication. as well as connecting them with other providers for other particular goals they may or may not have with regard to their gender journey, to help them feel most aligned in this holistic sense. And that's for me. So, you know, oftentimes I'll get the question of like, how would you rate my voice? Or does my voice quote unquote pass, or is it cis assumed? And I can't answer that question because I'm like, I also have biases. I also was like brought up in a society and had expectations around gender binary of what masculine or feminine is. And I'm one person. And oftentimes we don't have control over how we're coded when we're going out in the world. But the thing I try to like reinforce for clients, even though there's a safety component for sure, is that the thing that we have control over is setting our goals, feeling what makes us feel confident in our voice, what makes us feel empowered in our voice, understanding how our instrument works and navigating that. And so, yeah, I mean, I think that's the crux of what gender affirming care is from my particular scope.
Well, I appreciate you painting that picture. But it sounds like, I mean, even beyond gender affirming care, is that if you're taking a lens of kind of the DEIB framework and viewpoint into your practice and not creating assumptions, instead learning about who it is that you're ultimately serving in that relationship, is that the person coming in is the client. You're there to help fulfill whatever it is that they're hoping to work on. So
Right.
how do you build that into your practice? Because there's a lot of people right now that would love to be able to be far more inclusive, far more aware, far more supportive in the way that they're practicing and don't know how. They become buzzwords. And it's like, how do you take that and implement it into a voice practice?
I think the biggest thing that I always had to set for myself is that, you know, I have to recognize that biases and assumptions are going to come up as I meet somebody, irrespective of all of the experiences I've have, despite being South Asian by background, like being, you know, queer identifying, non-binary, all of these things myself, as I also have them. That doesn't have to be a shame point. That just needs to be a, hey, that's a filter that comes up for us just by nature of being in a society and being raised in a certain way. And you really have to just remember, okay, I'm putting that on the shelf because I'm meeting someone,
Mm-hmm.
you know, and we have a blank canvas that we're filling in as they give us information. And even the silent points of places they may not want to go, that we shouldn't like push into, or things that are not being said, are information for us to glean about this person so we can make something that's more three-dimensional. Like we get to be this like, you know, 3D printer in a way um, in our clinical practice of putting in data as it comes up and getting to be open-hearted and curious. And I think the more that we want to learn about communities outside of the therapy room, is a really great thing. So being able to read about many different trans and gender expansive experiences, being able to read about people of color across the spectrum, just to hear about like different experiences that people have. Because honestly, when it comes to all of those intersections, every individual is going to have a different experience. And I think as much as we remember that we can't know everything,
Mm-hmm.
and being humbled by the like how much knowledge there is in the world and how many perspectives exist in the world, allows us to kind of remember, okay, you know, we have this one lens and we're trying to fill in this picture each time with a client with stuff that we don't know. And it can be as many people who feel intimidated about thinking about, or fatigued even thinking about equity, we make it real and engaging for ourselves when we make it about the person in front of us.
Mm-hmm. And I mean, so I would say is that we're in kind of polar opposite demographic areas. Is that
Yeah,
you're in the Bay Area. I'm living in northern Idaho. It's like the amount of diversity in our two areas couldn't be more different.
for sure.
So when you're talking about being able to educate oneself, is that a lot of folks that are out where I live is that they don't have the experience to be able to cross paths with a lot of people that are different than them,
Yeah.
who have different perspectives, different lived experiences. So it is important to read about more. It is to get out of the news cycle of what's being told to you, is to go out and try and learn a little bit more by talking to people who have experienced it and who
Yeah.
live different lifestyles and different life experiences than what you do as an individual. So I love the fact that you're giving that recommendation to folks, because I think it's so important, because not everybody has the opportunity to enrich their lives with a lot of diversity, just because there are areas of the country that don't have a lot of that to be able to be offered. But when you're talking about the ability to be able to take that and move it into practice, what are the benefits and what are the downfalls if you're not doing that correctly? If you're not empowering somebody the right way, like, what are you creating in the other end of the extreme if you're not really looking at the individual and you're not affirming their gender through the therapeutic experience?
Well, I mean, I think for the most part, when we get into this work, when we're talking about allied care, where there's a counseling component to the work that we do, we're trying to do harm reduction. We're assuming that, a lot of the people who come in to see me have been harmed by traditional medical models in the past, or educational models in the past, or a number of other systems they might have encountered. And so I don't want to be the place where they associate with not feeling safe or feeling harmed, because that's not in line with my clinical ethos or philosophy at all. And obviously we have guidelines for national organizations that we're part of in our certification, and licensure that underline that as well. But there are times where I felt I leaned in too much into what I thought would be good for a client, and it makes the person feel alienated. They don't want to engage with you, or may not be honest with you about like what works for them, or whether they're getting value from the time that they're working with you. And then there are times where I feel like as I got more clinical experience, I facilitated more of an open space and more of a dialogue. And over time, even though people were maybe a little bit reticent or a little bit avoidant of doing like some of the voice work, which is understandable for different neurotypes, we were able to find something that really worked for a lot of the clients, and they were engaging and starting to find that they were making progress on their own terms. And so, I mean, I think the thing that, I think the worst case scenario for not doing the work to make our clients feel safe is that they don't trust practitioners at all, and they avoid practitioners overall, even when we're talking about situations that are even, life and death considerations. They may not go and seek care in a timely manner. And, I think, one of the unspoken jobs that I take on is to help somebody restore hope that they can find practitioners that make their life better, like holistically, and that they can experience a more quality of life because they're engaging in some of these services.
Mm-hmm.
So we don't want to not know how somebody's doing until something is too late. And I think that's the thing that keeps me motivated as well.
Well, that motivation is extremely important, not only for your individual clients, but is that voice that you're empowering through your client. Are you also sharing with other practitioners ways that they can be able to do this, ways that they can be educated to take their discipline and improve upon it by being more affirming in their care model, whether it's neurodiversity affirming care, gender affirming care, at people affirming care? It's like, eh, do you coach others ever on these concepts? Because it feels like most practices would benefit from being able to take their scientific knowledge and immersing this view and making their therapy even stronger.
Sure. I mean, I definitely am open to coaching people in practices and have done in the past. I also I present really frequently at conferences. The American Speech Language and Hearing Association, or ASHA convention, is in the first week of December in Seattle this year. And so I'll be presenting on different topics related to voice and AAC with Karina Seychow, as well as doing a panel on navigating trans healthcare with a group of wonderful individuals. And with Jenny Cleary, one of my colleagues from Trans Voice Initiative, we're talking about case studies in which we're like navigating gender affirming voice case scenario examples and talking a lot about neurodivergence considerations, as well as another thing that's coming up is Kevin Dorman and I are doing a gender affirming voice training or gender voice training at Colorado University or University of Colorado Anschutz, which is in Aurora, Colorado, near Denver. And so that's something in January to look forward to as well. But yeah, I mean, we present a lot. I've done some talks on intersectionality with Credit Institute, which is run by AC Goldberg. I've done some other talks that providers can access at Learn, Play, Thrive, as well as Jeremy, just note here that like you might have to cut a delay. Bright Ideas Media, I've also done some discussion on gender affirming voice care, and you can check them out at bethebrightest.com. So there are a lot of online resources that I feel like are accessible to a number of allied health providers, as well as like in-person conference. And yes, like I would love to hear from people who are interested in coaching. And there are a ton of great folks who are doing this work with relating to DEI, equity, neuroaffirming, and gender affirming care in the field. So yeah, I appreciate you highlighting that.
Well, I mean, just being out there speaking about it, making others aware, having others start thinking about it themselves, which might create more folks going to read about subjects, talking to people that have experienced that lived experience. It's extremely important. One of the flaws and misconceptions that we often have is that we look at neurodiversity as a singular culture, and within neurodiverse people is that they identify as so many other things as well. And one of those things, as you mentioned, is that there is a trans community that's neurodiverse, autistic as well. And oftentimes is that you're talking about a lot of marginalization that's occurring there. You're talking about society creating barriers for acceptance. And then you're also looking at some of the challenges that one might have by being neurodiverse as well, and being able to kind of find their community to navigate through being empowered. Can you give us some, I guess, some stories, some experience to highlight how important it is for individuals that are going through not being fully accepted by every community they're in, and empowering them to show acceptance and to help them build skills at the same time? Do you have stories that come to mind?
Yeah, I mean, I've found that there are, I think when individuals who've experienced multiple marginalization in that way for trans community that overlaps with the neurodivergent community, I think one thing is that being aware of how difficult these pieces are, and for people to use people's names and pronouns, and and giving places for people to feel safe, like the basics of having all gender bathrooms and things like that, just so people have a place that they feel safe to go, or if people need a quiet space. I think all of those like general expectations are really good to have. I think being able to, as a practitioner, whenever somebody comes in, to have a game plan of like, if you need to advocate for them because they've experienced harm in your organization, having a really clear follow through of how you're going to document that, how you're going to address that situation. If you're going to have an in-service, making sure that your organization or your clinic is getting trained in terms of providing neuroaffirming, as well as like gender affirming care is important, and making these really concrete agreements so that and following up on them, as you say, that you're going to build trust with clients, especially when they've experienced those kind of barriers, is huge. I think also uplifting the fact that these people do have communities, whether it's with the local Oakland LGBTQ Center is one example, or if there is clinics that focus on trans healthcare specifically, and a lot of these. A lot of communities that are trans as well as neurodivergent also find homes in like disability related communities, as well as advocacy and that sort of kind of restorative justice. And so like I think understanding that those communities exist for people as well, and being able to be well versed on where are their support groups, where are there like people who've been vetted out in terms of like allowing communities to have that sort of peer support, because I think that's where people find their sense of strength in communities with their own often, and being able to facilitate that and make sure that people are connected to those resources, whether they're in person or whether it's on Discord or Reddit or other like online resources, or they meet on Zoom once a month. All of those things are really impactful for clients in terms of, not us necessarily having to help folks always be in the mindset of integrating into what people consider like a mainstream, but being connected with others who are navigating a lot of the same challenges and have experienced a lot of the same challenges. Being in a collective is huge.
Yeah, having a safe space, having those community resources are so important, just for mental health, just for well-being. It's just being able to kind of have that sounding board to eventually just talk through things that you're feeling and experiencing. But I do want to get back to just, and I guess I'm going to steal your time right now, just to help
It's
guide
fine. I'm here.
clinicians, is that we have resources that are out there. We have so many wonderful clinical resources that the community should be able to access. But the clinicians don't always have the blueprint on how to be able to get through, and maybe the 2-3 important things before they even start their therapeutic model that they should be doing. Are there tips? Is there a blueprint of saying, hey, you know what, you should be doing this, and this before you even get to your therapy, is just set up that relationship? What would you be guiding them to do?
Are you talking more about like making services more accessible, or are you talking about more about rapport building?
I think it's a little bit of both. I think that is that accessibility comes with the more that somebody's able to educate themselves. Now they have the skill sets to be able to help more communities. But then once you start that session, so that you're not being prescriptive or dictatorial on how you're telling somebody they need to go about living their experience, it's like, how do you create that safe space within your treatment for somebody to really grow and develop?
Sure. I mean, I think one of the first things that I do when I'm on like the phone intake, maybe I get a referral or somebody has called in to seek, services, is I usually tell them, I am always like learning, and this space is really about you getting the best care and care that you feel is valuable. And, there is a no expiration date on if you ever have to call me in about something that needs to change in my practice. And it doesn't matter how many years it's been, or how you want to do it. It can be via text, it can be via Zoom, it can be via email, it can be a secure message, it can be, a phone call, whatever it is that is or you want me to give you an anonymous form or something. I want to hear about what your experience is like and how we can change things in real time, as well as for other clients in the future, and that I'm always receptive to that, because, this space only exists because clients show up, and there is no practice, or there is no therapy or voice modification, voice training without them.
Mm-hmm.
and I think demoing what that could look like is, you know, and giving an example of like, hey, if I were to do something like, if something like this could happen, this is totally, reach out to me, this is how I would want to follow up, and giving them that concrete, like, I genuinely care about making this space comfortable for you. Lots of options, especially if you're working via teletherapy, is giving people the option to stay off camera, giving people the option around, you know, sometimes in voice work, working with a mirror to get the feedback of like where the positioning is of the jaw, the tongue, and all of that can be really helpful. But some clients are going to find it uncomfortable or may experience dysphoria with that. So giving a lot of options about how they can use tactile sensation to feel these things. Basically saying that almost anything in the therapy model can be adapted. You know, when we watch like a yoga video, they always have a modified version of something. So understanding, like, just using that model of like, there can be modifications for everything, because something is only useful or going to make progress if it's something that you feel safe doing. And you feel like is helpful for you. Otherwise, you know, we're not actually, you know, getting to make progress together. I often tell my clients that they're technically my colleagues and we're working together. You know, we're kind of working on a recipe together, or a project together. And so I try to set it up that, you know, there's been so much encoding around a power differential between a client and a clinician, through all of our traditional models. And here I'm saying, hey, I don't know what to do. This is your ship to drive. You know the directions. I know, maybe, like, you know, I can give you a sense of where the wind is blowing, or like, I'm here to like be a guide and a support, and give resources, but you know where you want to go at the end of this. And that's what I'm most interested in supporting you in. So I think laying out that leveling sort of conversation early on and reinforcing it often is important. And sometimes, you know, clients are going to want answers. They're going to want you to really, they're going to want to give you the steering wheel, and you have, like, it's uncomfortable in those moments because you just want to, like, you want to ease their discomfort, but you also have to give like that gentle pushback of like, it's okay not to know. I can give you a few options of things that we can work on today, or we can spend some time working on this other thing and see what comes up. But you really have to hand them the reins as much as possible, without it being something that is, you know, distressing to them, and finding new ways to engage with that. I think the other thing is having a lot of compassion about late cancellations. Like, I think a lot of us, this is something I struggle with all the time, is that in the therapy world, there's a kind of expectation of you have to give this 48, 24-hour notice. And like, neurodivergent people can often have difficulties with time, myself included. Or sometimes things hit, or we feel like we're having a meltdown, and like, or not being able to communicate in these like high stress moments. And so being able to create systems of flexibility, or, you know, being able to navigate like what your agreements are per client and what they need. And not to say that a clinician can't hold a boundary for what is needed in terms of engaging with a therapy model or a voice training model, but I've had to like move the line here and there, and that's still that's still a work in progress for me in terms of figuring out what really works well for me as well as the clients. But you know, especially when we're talking about people who've been multiply marginalized, like there's a lot of different access points that are just not as easy for them to reach, and there are a lot of barriers, and we have to be sensitive to those things and adjust our practice modalities, or find ways to I think practice creatively. And so those are the things that come to mind as you bring that up.
No, I love the ship analogy. And I mean, I see it the same way, where, you know, ultimately is that somebody's got to be sailing their own ship, but we can provide the tools. We can provide, you know, some of the guidance occasionally on how to make the ship go in the direction they're hoping. But ultimately, everybody's got to take control of their own ship. And the empathy piece that you just mentioned right there, it is so important. No matter what you're doing, you don't know what somebody's day was before they got to your office. You don't know what somebody's last 2 years were as they were struggling through different parts of, trying to even figure out who they are or what their identity is. And it's having that empathy to understand that somebody's perspective and lived experience is a lot of who they are right now. It's important. But I appreciate you coming on, Ruchi. These are humbling experiences for me, is being able to learn from others and understand that there's so much I don't know. And if I heard you correctly in the message that you're giving, is that humility is so important in a clinical relationship as well. So I appreciate you exploring that, coming on today to educate us. And I'd love for you just to let us know one more time the best resources and ways people can follow you and know where your next speaking event is.
Sure. I'm at Kapila Voice on Instagram. And you can find me Kapila Voice on Facebook as well. My website is kapilavoice.com. So if you need anything, all of my upcoming presentations are listed under services tab on my website, and you can also feel free to reach out to me through that website as well. So I appreciate you having me on, Jeffrey. This is a really wonderful conversation. I'd love to be back again.
Oh, thanks again.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Google Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.